This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Health Center in Oshkosh. And you know, when it comes to sunscreen, we always think about summer, but it's actually something we should be doing year-round. That's why we're talking with Dermatologist Dr. Alex Means, who tells us we should lather up. Well, thank you for taking some time with us today to talk about sunscreens, and it's something we all know we should be using. And if people out there are like me, probably don't use it enough. Yeah. But let's just talk a little bit about sunscreens and the different types of sunscreens, because I go to the drugstore, I see a whole wall full of different sunscreens. What should we be looking for?
Yeah, well, my first disclaimer is that the best sunscreen is the one you will use, so I can't stress that enough. But in terms of the different options that are out there, we kind of break them down broadly into chemical and physical sunscreens. The physical sunscreens are the kind of, we think of like the Weekend at Bernie's, kind of white nose. They reflect the sunlight, so they kind of create almost like a paste or a film on the skin. And they've gotten a lot better, so they don't always leave that whitish tinge, but they do sometimes have a little bit of a hue that patients can find a little bit unsettling. Unfortunately, in my opinion, I think they tend to work a little bit better because, again, they reflect the sunlight. So they're usually my and most dermatologists' preference, but the chemical sunscreens also do an excellent job. They work really well. They have all those weird names that nobody knows how to pronounce, so things like avobenzone, oxybenzone, I can't even say them half the time, homicillate, things like that. Mm-hmm. So those tend to absorb the sunlight at the kind of higher energy UV, and they kind of release it into the skin at a lower wavelength. So there's a little bit of a chemical transformation that happens, which is why they're called chemical. They tend to go on more easily. They tend to often feel better for some patients, but patients with sensitive skin often do better with the physical sunscreens, because again, they're not necessarily getting absorbed anywhere. They have probably fewer stabilizing molecules and things like that that would help the sunscreen kind of remain more stable, both in the bottle and once it's being exposed to light on your skin.
Sure. I know a lot of people will look at the different SPFs.
Yes, yeah.
What should we know about that?
So another kind of controversial question at the moment. There are some recent studies that show that certainly higher sunscreens may provide better protection than lower number sunscreens, but the confounding variable in all of this is that people often don't use enough sunscreen. I'm sure we've all seen, at least my mother does this, she'll take the smallest little pea size amount and she'll rub it all over her face, and it's like, really, you should be using a shot glass worth of sunscreen to cover your body, which and that's just exposed parts. You need to use more if you were in a bikini or something like that on the beach. So I don't think people use enough sunscreen. And so that's why our blanket statement of SPF 30 per the American Academy of Dermatology should be enough if you are using the right amount. So I always tell patients, and I use myself, an SPF 30 every day, at least to expose parts of the skin. And then certainly if you're going to be outside for more than 2 hours, you want to reapply. If you're going to be driving into work in the middle of May, you can use something in the morning and then maybe just keep a tube in your office desk and then reapply kind of before you start your drive home. UV does get through windows and glass, and that's something I think a lot of people don't realize until they have a friend who maybe works as a driver or a trucker or something like that, has a desk by the office window, and then they can really start to notice the sun damage is worse on the left side of the body relative to the right.
So you mentioned a couple of months during the year. I think a lot of people think, well, I'm going to the beach, I'm going to put on the sunscreen. But is it a year-round
I tell people the UVB is worse in the summer months, and that's kind of the 10 a.m. to 4 p.m. Not such a problem in the winter, though we still have some of that, but worse definitely in the summer. The UVA levels, however, and again, those are the ones that get through windows and they get through glass, those do not necessarily fluctuate as much, and so it is always important to be kind of protecting against those. They contribute, again, less to probably individual development of skin cancers, but certainly to the overall aging. And I always remember A for aging, B for burns. UVA is the one, again, that kind of year-round, contributes to skin aging and thinning of the skin. UVB is the kind of peak sun hours more likely to give you a sunburn.
I've also heard some people be concerned about the chemicals in a sunscreen product. So is there a concern in terms of putting sunscreen on chemically for themselves or even for the environment?
I think we're learning more about this, and it's a great question. I'm really glad you asked it. I think we know that sunscreens that are FDA approved currently and in use are safe for human use. There's an evolving kind of dialogue about whether or not some of these chemical sunscreens, namely oxybenzone, when they are washed off into the sewers and things like that, or if you're, for example, on the beach in the ocean, do they have the potential to accumulate in fish, and do they have the potential to kind of destroy coral reefs and things like that? It's an ongoing area of research, so I won't comment too much about it, but I'll say that if there's ever a question, just use a physical sunscreen agent. I think certainly in pregnancy, the physical sunscreens are probably better studied in terms of their safety data, and we know again that they're not necessarily absorbed, they reflect the sunlight, so I think that's also my kind of recommendation for any young children, pregnant women, special populations, and then also if you're just concerned about the environmental impact.
Should we be taking different steps for a toddler or for a baby?
You know, the most important thing with young children, I think, is just keeping them out of the sun for the first probably 6 months as their skin is still developing. Certainly if they're a premature infant or something like that where their skin just needs more time to kind of adapt. Neonatal or kind of like infant children have a much they have a much higher absorption of things that are applied into their skin. So that's why we really don't have a strong recommendation to be applying sunscreen to young babies. We should just try to keep them as best we can out of the sun, or using other kind of protective measures like hats, the kind of covers for carriages and things like that. But starting at the age of probably 6 months, I think sunscreens are all right to use, and I think the physical blockers tend to do a little better job.
Sure. Whether you're an adult or a baby, take care of yourself in the sun.
Please.
Yeah. Thanks for your time today.
Thank you.
You know, as we get a little bit older, we should probably start thinking about that annual skin screening. You can always give us a call here at Aurora to talk about it. Dr. Alex Means available at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.